medicine is not really science. It's kind of medical science is kind of an oxymoron. The notion that we apply strict scientific rigor to medical enterprises is erroneous. It turns out that medicine is influenced by many things. It's influenced by politics. It's influenced by the profit motive. It's influenced by vogues. And so the term medical nihilism means that we apply a certain level of skepticism to medical developments. And unfortunately, in medicine, there's sort of a headlong rush to make advances and to introduce new techniques. And what Stegenga says is that some of the methods by which we vet our medical therapies are thoroughly unscientific in terms of pure scientific reasoning. And he critiques our methodology in doing that.
So, Rob, let me bring you into this. That's really interesting. I've never really thought about medicine as not scientifically based. That's an interesting proposition that you raised. Rob, as a scientist, do you concur with Dr. Hoffman?
Proper sort of methodologies that we would regard as important in science, which are really around experimental design, statistical power, statistical methods, sample sizes, randomization, all these kind of processes that really allow you to determine if studies are what we might call high quality, are not a big part of an MD's education. And so the thing that always staggers me, I see so many doctors drawing conclusions from abstracts, whereas us PhDs, we pretty much discount the abstract and we go into the paper. If we can only get an abstract, it's really not worth reading because, that's often been written by the university, by PR people, by the funding bodies. It frequently, particularly when you're looking at drug trials, does not really accurately reflect the results of the study. Medical nihilism or nihilism, we're all going to try and pronounce it the other way around, could be in some respects a good thing, in the sense that if we recognize that some of the medicine, including, say, the most commonly prescribed drugs on the planet, don't do a lot of good because there isn't a lot of good science to support them, that does not mean that medicine itself isn't good.
It is simply no longer possible to believe much of the clinical research that is published or to rely on the judgment of trusted physicians or authoritative medical guidelines. That's a pretty remarkable statement from someone who emerged from the belly of the beast, so to speak. Really, she was, front and center as a spokesperson for conventional medicine.
In the real world, and moving to what we could do instead is this idea of measuring effectiveness rather than efficacy, accepting the fact from a statistical point of view, we're going to have a lot more noise in the system. But my goodness, if you start to then see effects, you are getting really robust effects that can, if you like, rise above the noise. So the kind of approach that we're moving towards in that regard is moving towards pragmatic trials, observational studies. So you can do, say, a prospective observational study where you are looking at what a long-term study that might run over 10, 20, 30 years to see what the outcomes are, predetermined outcomes, measuring specific biomarkers or other outcome measures.
A useful concept is something called NNT, number needed to treat. And this is a good way sometimes of really explaining to clinicians who are going to be deploying these medications and the public who's going to be accepting and using these medications of the true value of medications. And it turns out that, say in the instance of something which improves bone density by 50%, you have to apply an NNT, a number needed to treat statistical analysis sometimes to really understand what that means. And what that may mean is that you may have to treat 50 or 100 people for 5 years with the potential for side effects in order to reduce one fracture.
Certainly, I think an argument could be made that right now, politically, we're in anarchy. We're in a place where nobody gets along with anybody. Everybody who questions vaccines is anti-vax. Everybody who doesn't is, anti-science. And, and listening to Rob, your explanation about the dietary studies, it seems like we need to be skeptical of both sides of that equation, and that the truth, as you said, is somewhere in the sweet spot. So I asked the question, when we look at something like research, and the next pandemic that comes along, what would be the right answer to that question? How do we both fill the need for an expedited something that can fix the problem, the magic bullet, as the author talks about, or is that just not even achievable at this point?
The vast majority of drugs and or vaccines are approved on the basis of limited, relatively short duration trials, which show a benefit, but in what's called post-marketing, which means it's unleashed on the general populace, seldom are drugs or vaccines as effective and safe as they were touted in the original studies. So I think that that's the perspective to take, is that, we want to make a risk-benefit analysis on virtually all the therapies that we opt for, and make intelligent choices about which ones to onboard.
The very fact that we are nowhere near getting to a place where, for example, ivermectin and other nutritional protocols can be seen alongside vaccines, both for prophylaxis, for COVID-19 prevention, and for early and late treatment, is a major stumbling block in terms of good science being practiced and good medicine being practiced.
And it seems like this plays over and over again: tobacco, cell phones, drugs, and always it's about this convolution of the truth. There's something being suppressed that raises questions about a very financially important industry, and somehow that data gets pushed to the side, and the data that serves the financial interest of that industry seems to come to the fore. So it seems to me that the issue that we face across all of these industries with all of these different health concerns is the playing field. It's not level. And the question I have is, how do we level the playing field? And obviously, having a bit of skepticism about what is being is essential to that, right? And to creating that political or that level playing field. So, any thoughts on, as we're sort of beginning the wrap up here, how do we level the playing field? How do we get it to a place where something like ivermectin is going to be studied with the same seriousness as, the Pfizer vaccine?
We need to have a little more less buy-in, shall we say, to the very, very aggressive marketing of medical procedures and techniques.
I think the system is so deeply broken and corrupted at the upper levels that the solution lies with the grassroots. And frankly, it's one of the reasons that we're all involved with the Alliance for Natural Health, because we are an alliance of interests who really care very deeply about the future of humanity. What we call healthcare is actually nothing more than a disease management system. So we're actually, in the Western world, not very good at doing healthcare. Healthcare starts preconception. It occurs throughout an individual's life. It should be all about increasing health span, not necessarily lifespan.
As skepticism is a necessary thing, and as I think Ron and Rob, both of you have pointed out, we need to be skeptical. It's imperative that we are skeptical, but that's not enough. It's not enough just to be skeptical. And I think that that's oftentimes where we stop in this culture. We turn off that channel. We put down that book. We reject that idea because of where it comes from. And we don't take the next step, which is we need to educate ourselves. If it's one thing to reject something else, but you got to fill that void with something else. And you have to be open-minded enough to step outside the paradigm that you're currently stuck in, and realize that we're all stuck in those paradigms.